Hello, my name is Dr. Jaber. I'm a vascular surgeon in Southern California. I would like to thank the selection committee for accepting our abstract. I have no disclosure pertinent to this presentation. We are presenting the 22 patients to highlight the impact of securing PD catheter into the abdominal wall laparoscopically. This will keep the PD catheter away from the omentum, and we think that this will increase the functionality period and longevity of this PD catheter. We performed a prospective review of 22 patients in a 2-year period, mean follow-up 16 months, and with minimum 1 year to be enrolled in the study. We used Argyle peritoneal dialysis catheter, and there is nothing special about this catheter. This is the one company that our hospital is contracted with. 12 patients presented with a recurrent malfunction of PD catheter and abdominal pain, mainly non-draining. And we used this technique in these patients. And we used this technique as well in about 10 morbidly obese patients. We primarily used a Carter-Thompson technique that used for port site closure. Again, this is the Carter-Thompson device, and I do not use the introducer just because you have to make a bigger incision. You easily can do this with a small 2 mm to 3 mm incision. Basically, the procedure, you make a small incision, and here is where you have your PD catheter inside here. And basically, you make an incision, you place a Thomas Carter needle with a 3-O-proline, you try to wrap it around the PD catheter. They take the needle out, place it in a different place, and come back and pick it up and tie it. That's really the procedure. Nothing fancy. There's another way of demonstrating this. This is the back of the patient. This is the abdominal wall. And again, you place a 3-O-proline, you pick it up, and you tie it. This is a picture how that looks like in a human being. You see the proline is around the PD catheter, and the way you do it, you try to, most of the time we don't have to place a port, as additional port for that. We just place a camera port. If you place the proline far away, as far as you can, and around the PD, that would makes it easier. And you see, then you pick it up here and you tie it loosely. You tie it loosely because this will help. Basically, will help if you need to remove it. You don't have to cut the incisions. And this is how it looks like with a very low CO2 pressure, like 2 or 3, 3 or 4 pressure CO2 pressure. This is a patient, 36-year-old male, who presented 6 months after the PD catheter was placed. You see the omentum wrapping the entire PD. I did insufflation through the PD catheter, and thus you see the omentum. You see the air right here. So this after we tried to remove it. It was difficult to remove, and it has a lot of clot that was difficult to clean. So therefore we removed this PD catheter. And if you look at the adhesions, they're pretty dense. If you look at the CT scan here, the PD catheter in the right upper quadrant right here, the subhepatic area. This is the new PD that we placed in this patient with the, again, use this technique. We had to use another trocar for this patient, and basically, if you look at this, we always make it loose to at least pass an instrument like that to make it easier to remove. And this is how it looks in the actual thing, so to speak, in action. See how it's draining very well, and there's no problems with it at this point. And you see we had a results of our review. We had 100% patency at 1 year, and the mean follow-up 16 months. I apologize for the typo. PD catheter had, one person had a PD catheter infection that we had to remove. Again, you make it loose, and that makes it a lot easier to remove. One person needed to switch from PD to hemodialysis, and also we removed that easily. All patients had functioning PD during the study period. In conclusion, laparoscopic assisted peritoneal dialysis or transperitoneal PICSI of peritoneal dialysis catheter of the abdominal wall is an alternative to omentum PICSI At least we think so. This study obviously is very small. We need more patients to confirm these findings and further evaluation as well. But looks pretty promising. Thank you very much and have a good evening.